friends, this is Laura with Potpourri of Life. I hope that you're doing great. Today what I wanted to talk to you is about healthcare. A lot of us are saying that it's broken, it's fragmented, it's whatever you want to call it, but it's not working. And as a patient, I find that it's kind of broken. And then you listen and you watch and you read and you are aware that this isn't just broken on the patient level. And I've known this long before now, long before COVID. It's just that once that virus came about and it disrupted the whole situation, patients have become more and more aware, more and more frustrated with how they're getting care. And as somebody who recently turned 63, I'm looking at what is my outlook for my future in reference to how will I receive healthcare? How will I be treated? Because sometimes I feel like there's a disconnect, and I felt this for a while, and things have been progressing. And maybe 1 or 2 years before COVID hit, one of my nurses had shared with me, because they had made changes within the system, and she said, Laura, we did not expect it to come this fast. They knew these changes were coming along, but it hit them hard. And so patients are trying to adapt to the changes and stuff like that. And I'll share a few changes that I am uncomfortable with. But what happened is, and then COVID hit, there was no turning back. We are into this realm of healthcare that is just not healthy, in my view. And please understand, a lot of what I say is my personal view. I am not a physician. I no longer work in healthcare, and I loved working in healthcare. To this day, if things weren't the way they are today, I would go back in healthcare, even at my age. But things have changed so much that it makes it uncomfortable. If I am uncomfortable as a patient, why would I want to go work for them? Now, there is an article that I would like to share with you. And why am I sharing this? Because this is truly what a physician is experiencing. And the other reason that I'm sharing it is because every time I'm getting frustrated with the care I'm receiving by people that I have counted on, people that I have trusted, who have always been there for me, are not. And my husband and I have talked about this, and I said, I don't believe they are doing it intentionally. I think their hands are tied. Do they want it this way? Possibly, but I'm not too sure. But the part here is healthcare isn't broken, it's fragmented. I will try to remember to link this article below. It's from MedPage today. And it's a doctor, and it's her quest to piece together the American healthcare. A few years ago, I was the oncology doctor on call when I was paged about a new patient in the intensive care unit. The patient, whom I'll call Beth, was weak, so weak that first she struggled to stand from a sitting position and later had trouble lifting a cup of tea to her lips. Next, the muscles of her jaw weakened so that chewing solid food became all but impossible. As the muscles of her eyelids became affected, she concentrated to keep them open. Finally, her diaphragm became too weak to do its job. Can you imagine? As she gasped for air in the emergency room, her doctor had no choice. She sedated Beth, inserting a breathing tube down her throat, and connected her to a ventilator. And from there, Beth was wheeled on a gurney to the ICU. ICU is intensive care unit. I was on call because Beth's underlying bone cancer that she had been battling with for the past 3 years, after several kinds of chemotherapy had failed to slow its growth in Beth's lungs, her regular oncologist chose to try immunotherapy, a relatively newer class of medication that uses the body's own immune system to fight cancer. It was just 2 weeks after receiving her first infusion that Beth weakened to the state in which I met her, unconscious, nearly paralyzed, and wholly dependent on life support. To stop there, I stop and think about how would I feel as a patient, and regardless of as a patient, as a human being, to be kept alive by machines. We all have our own personal viewpoints on being kept alive, And David knows, and it's in my my proxy or my living will, that I don't want to be kept alive, not in this type of capacity, because it's a lot of money. It's just a lot of work. And how would the person end up later? Could the medication have caused this? This was a question posed to her, and more important, could it be reversed? These are the questions patients ask all the time, or the families ask all the time. This doctor searched the medical journals and had a few ideas for how we could treat her. We could thread a large catheter into the vein of Beth's neck and try to filter the drug out, pulling the harmful agent aside while returning the rest of her blood back to her in a closed loop. We could infuse high doses of intravenous steroids to calm her immune system, which I suspected was overreacting to the drug and counterintuitively hurting her. And that's one thing I've learned on steroids, that can happen. It can do a lot of other things too. But we could try a medication typically given to help treat other neurologic illnesses and cause weaknesses. Each treatment carried unique risks, with none guaranteed to work. This is something that healthcare providers in ICU, when you go into the emergency room, or even when you see your physician, they have to grapple at what is the main problem, how can they help you, and what has worked and what hasn't. As I go on, but there was one gaping hole underlying all of these possible plans. This was not the first time Beth became paralyzed after receiving immunotherapy. The oncologist who had given Beth the medication knew paralysis was a possibility. About 1 year earlier, Beth received a similar drug during a clinical trial in Cleveland and became so weak she needed to be hospitalized in the ICU. But the doctor also knew that Beth would recover completely, or had recovered completely enough for her to later calmly and decisively agree to give the new medication a try. Those with cancer, those with any illness, they're desperate to want to live a fulfilling life. And so if there is a medication that gives them hope, most patients, most of us, want to give it a try. There are things that I tried before. We want to live, we want to thrive in this world. We want to be with our families. And so that's why she wanted to do it. So I promised her that if this happened again, we could treat her, the oncologist told me over the phone. Find out exactly what they did in Cleveland, then do it. So this doctor writes, I am no stranger to working under pressure. Being a doctor requires performing effectively under the weight of extremely high stakes. I have led emergency responses to patients whose hearts have stopped pumping and have managed massive transfusions for patients bleeding out. I am accustomed to taking a deep breath, dropping everything else, and getting to work. If you've never worked in a hospital, when there is a dire emergency, it's like the out from the walls comes everybody that wants to help and try to make sure that that person lives. Yes, I've watched this firsthand. It's really kind of interesting how everybody comes together and everybody has their part. They want the patient to thrive. They want them to survive the circumstances that they're under. Now, this doctor confirmed with her son, Beth's son, who was also her healthcare proxy, that Beth would want to try everything possible. That was in writing. I told the ICU attending doctor, whose confidence that Beth could get through this flagged with each passing hour, that I needed a little more time. The clock was ticking, only this time the situation didn't depend on how well I could do chest compressions or halt a hemorrhage. A life was just as much at stake, but it was based on a far more mundane skill, how quickly I could piece together a medical story. Keep that in mind. There is an assumption in an interaction between a doctor and a patient. It's so basic that it is rarely vocalized. The doctor knows the patient's story and is making decisions based on readily accessible information. Sorry about that. Anyone who has come into contact with the healthcare system intuits an understanding of medical care as fragmented. And this intuition usually manifests as a question: don't my doctors talk to each other? As a patient, have you asked this? I have. I might go to a doctor and it's like, it doesn't seem like they're communicating. They can be in the same system, and for some reason, they're not communicating. They see notes, but it doesn't seem like they're communicating to the effect of you leave feeling like, well, they didn't hear me. And I'll go back to that. From the moment I became a doctor, I prepared to face profound uncertainties because human life is uncertain. I knew that my patients' symptoms wouldn't fit textbook definitions. I knew I would puzzle over what to do about test results that landed in gray zones. I knew I'd have to synthesize high volumes of information quickly. I also knew that in the face of incomplete or discordant information, I would still have to make hard choices and act. Grappling with these gray zones with the draw for me, I was motivated to be vigilant about evidence, learn something from every patient, and develop the judgment to try to be right as often as possible. But over my years in practice, what continues to stun me is how deeply uncertainties in medicine are compounded, not only by what is unknowable, but by what is simply unavailable. Medical records vanish as patients move from one hospital or a doctor's office to another. Critical data gets lost in a muddled electronic health file. Confusing payment practices block patients' ability to follow up with the same doctor who knows them. The result is that being a doctor means working in a constant state of being partially blindfolded, grasping at bits and pieces of a patient's narrative to try to craft a coherent whole. They're just trying to understand this person with their body, with their complications, and what their needs are. Sometimes as patients, we forget that. We go in, we see our healthcare providers, and what we see is right here, about me. And many times, most patients don't look at the nurse or the doctor and realize that they have a life, they have other patients, they have all these other things going on, and yet they're still trying to serve us in a manner that is compassionate. I have learned to live in a different gray zone from the one I expected, often applying my vigilance to patching logistical holes. I spend many off-duty hours sleuthing through disorganized patient charts. I have devised elaborate workarounds to double and triple check against gaps. I do these things because of a fundamental belief that the patient's story matters and that the devil of good medical care is in the details. But I also know that despite our best efforts, patients everywhere still slip through the cracks, and it's happening. It has become a cliche to say that healthcare is broken, but the truth is, this saying runs much deeper than our political and public discourse lets on. My vantage point is the medical trenches has cemented a conviction. Fragmentation, or the insertion of gaps in a patient's story, which blindfolds healthcare workers to the whole, is the single greatest problem underlying American healthcare. While tying together cause and effect is notoriously difficult in a complex field like medicine, fragmentation's fallout is an incalculable and compounding cascade of problems throughout the entire healthcare system. Blood tests, scans, and even procedures are duplicated both within institutions and from one institution to the next. Vital omissions lead to misdiagnoses and suboptimal treatments. If you ever looked at your medical records, and I have tried to fix mine, but they don't remove things. And I have left doctors because they put something on my chart and I haven't gone back. And it's sitting there. And it didn't make sense. And they said, well, we're going to leave it on because that's what we believe. And I'm like, but that's not true. And they didn't do follow-up, so you want it removed. You can't get some of that stuff removed that is no longer pertinent in your life. So, and I once had medical records transferred to another hospital medical setting where you're in clinics and everything else as well. And what gets transferred is, in one hospital, there is duplication upon duplication of stuff. it's a mess. And I would, in that setting, the older setting, I would talk to my primary care, and I told her, I said, this is duplicated here and here. And she would go in and she would fix it. The next update the hospital did, it brought all that stuff back. So it was more, so when this doctor says that we have duplicated information in healthcare files, it's annoying to me, and it's confusing because I'm like, that's not true. That's not true. I think the system I'm in right now, the one that sees me the most of it's accurate, not all, but there is some duplication in there. So this is what the doctors are looking at. So when you go to an emergency room or you go to see a new doctor, they don't necessarily have your whole story. Then there is wasted labor. In the absence of a system that reliably connects the dots, an enormous burden falls on doctors, patients, and devoted family members, all of us forced to navigate an administrative maze excuse me, at the expense of focusing on sickness and healing. So the doctors, the patient, and the family want healing. They want answers. The data mirror my experiences. Doctors spend 2 hours on the computer task for every 1 hour of facing patients. So if I see a doctor for half an hour, he's on the computer for another hour. A doctor sees 16 patients in 8 hours. Multiply that 8 hours by 2. That means they're not getting sleep. Now, do I think it's that bad all the time? No, because I do know that they have helps and stuff like that. But that's the other problem, is this electronic system where physicians have to click this, click that, and do this. When I was, one of the doctors I saw when I was going for my Lyme treatments and stuff, every time they changed it, he goes, I'm just so confused, Laura. He goes, we have a whole new system and I have to figure this out. This is what happens every time they do an update. The doctors now have to relearn what they were already used to. And it's administrative, it's a puzzle. But it's not just the administration of the hospital and the doctor's office and all that. It is also the insurance companies. So nearly half of doctors report burnout, with bureaucratic demands listed as the #1 cause. This stayed true both before and during COVID pandemic. Those saddled with the most clerical tasks are quitting, sacrificing a decade or more of expert training under the crushing weight of not being able to do their work well. Work with such incredibly high stakes. Meanwhile, patients squeeze in phone calls while tethered to IV poles, carry around briefcase worth of data, repeat their medical traumas to dozens of new faces. Those less equipped to keep their storyline straight undeniably receive worse care. I worked with a girl who lost her job because of the medical condition of her son. She had binders for her son, because every time that she was referred to another doctor, she would have to bring this, because honestly, they just didn't know how to connect the dots. And a lot of times, doctors dismiss the patient or the parent as not really knowing what's going on. As a patient, yes, I worked in healthcare, but that doesn't make me better than anybody who's working in healthcare. It just gives me a little insight. So what was I? I was an LNA, and I was also a surgical tech. And then I came down with Lyme disease. So I was in healthcare for about 6 years. But still, there was a lot I learned. And I'm still learning every single day, and I want to do better. But as a patient, everything I learned was valuable to me. And when I saw that this friend had to do so much to prove her story and still be dismissed until she finally got all the answers, and her son is really, and she's been gifted because he's still alive. There was no guarantee for how long that he would live. So he's still alive, he's still functioning, and he needs a full-time caregiver. Now, my story of Lyme disease is not nearly that impossible. But what's impossible is that when I'm given a new person to go see, sometimes I'm not referred to a specialist that my doctor who might know and say this is a good doctor. They no longer can refer you to a specific care provider. And that's been happening for maybe 3 or 4 years now. And so what it's doing, it's leaving a gap, because you go back to the doctor who might have referred you and they say, well, I don't really know that doctor. And you try to get clarification. And so you end up questioning, does anybody talk to one another? And sometimes that's the way I felt. And more so when I was dealing in the trenches of Lyme disease. You go to a doctor and you ask them. My question was always, do you understand what Lyme disease is all about? Oh yeah, I know about it. I can take care of you. And this is what I was told. And then when you say, okay, I'm going to sign up and be your patient, everything changes. And you're told, I don't believe you have Lyme disease. And they repeat all the tests that I had done. And I keep telling them, you're not going to find anything, because everything, the symptoms I deal with, they don't show up on a test. And this physician who is talking here, she states, the story of how we got here is complicated. It's a story of misaligned incentives, unintended consequences, but the conclusion is not complicated. Our current healthcare system has failed. The question now is, how do we dig ourselves out? But has it failed just the patients? No. It has failed our doctors, it's failed our nurses, it's failed anybody who's working underneath management. We have tons of people in management, and they get paid really good money. And they are the ones making decisions. And if you take a look at healthcare systems and you look at the CEO wages, they're not doing the hours that our physicians and nurses are doing. They're not doing it. And they're not the ones who know you as a patient. So, and I'm not going to ditch them, but it just kind of makes you wonder, what is the incentive? And then you have, on top of that, you have your healthcare insurance companies. I have gone, over the last maybe 4 to 6 years, I would start something, and in mid-year they'll say, oh, you can't do that anymore, but never notify you, so you end up with an out-of-pocket that you weren't expecting. See, we're paying for the insurance for coverage, but they're not able to tell you clearly what they will cover. We can get a guidebook when we purchase our insurance. My husband comes home with one every year, and we can say, okay, this is covered, this, and this. But what they might not tell you is when you go for a radiology study, it doesn't tell you that even though it is covered, they don't tell you that you have to pay for the radiologist as well. So you end up with an additional expense. A lot of this stuff was not an issue years ago. In addition, what is happening is, because of the money finances, and this happened before COVID, because I had doctors that did this, they would have you go and do all these tests, and they'd give you a summary, but they wanted you to come back and have a conversation. And I don't have a problem paying for a consult, but I need to understand what the test results are first. And as of late, it just seems like it's muddled. It's in mud, and I don't understand. So I have to pay for another consult, or a consult that years ago, 10 years, 20 years ago, when you had a test done, the doctor would pick up the phone call and say, hey, these are the results. Do you have any questions? We can go into this in more depth in another appointment. They would give you that option, but they would give you a synopsis of what it was to work with. They give you some information now, but it's so vague, you don't have a chance to ask questions, and because of that, you are forced to go back in. Now, why are they doing this? Because some of the doctors never used to be this way. And so I can sit back and be angry, but I've decided to be above that, because yes, some doctors want more and more money, okay? But not all of them are like that. And I do believe that the majority of doctors, probably in my age group, mid to late 50s or late to mid-60s and stuff, maybe a little earlier. And I do think some young doctors went into medicine not because of the money. The money is the reward of hard work, of caring for their patients. But now they're caught up in something, most especially if they've been in this for a long time. Their pensions are caught up in this. My husband and I have been talking about this, and we both agree on a couple of situations. We both have said this is not what we expected. We don't believe this is the true character of the individual. Things have changed, and we've been seeing it get worse and worse. And it does make us wonder, do you buy insurance because you are considered just a commodity, not a patient? And this is where healthcare is broken, or you can call it fragmented. But as patients feel less and less valued as a patient versus a commodity, they're going to step back. Now, many of you who have been following me know that I do a lot of stuff with herbs. And I don't put it all online because I think before I get that way, I have to remind people that herbal medicine can be just as harmful as pharmaceuticals. But I also know that when we're treating ourselves, we can complement our own health with our physicians. So now this doctor mentioned that there's a lot of missing pieces. One thing that she didn't say is, what are patients doing on their own? Is the patient following the guidelines of the treatment plan? Are family members there making sure this happens? Is the patient kind of like, the patients get ornery because they're just tired of not being the person that they once were. I do believe there are many, many doctors who want to see their patients do well. I think their hands are tied. And so in order to keep their job, they kind of have to follow the rules. And unfortunately, patients get hurt. And so I want to read some comments. There's this one comment from, I don't know if he's a nurse or a doctor. He goes, "We have developed a perverse system of incentives promoting the development of electronic medical record systems that retain a morass of clinically outdated and administrative cover your backside entries." What does that tell you? What that says is that if you have an encounter with the patient, this is just one of them, and they respond negatively, that goes into that chart. And people can see that, and it's turned into a monster, in my opinion. So how I treat healthcare now, I might speak up, but I just kind of keep silent because I want good healthcare. And I have spoken up about stuff and how I've been treated. And then sometimes when I've called back to talk to a manager, they'll say, well, this is what they wrote in the chart. Well, what happened on my viewpoint is not in there. And that'll happen to everybody. So should we stand up? Yes. Should we be an advocate? Absolutely. But we have to also stop and think that the healthcare system, what they just went through, has been horrible for their mental health, has been horrible for their family lives, has been horrible all the way around. They are still human beings. So I think there's a happy balance between caring for ourselves and advocating for ourselves, but while at the same time caring for them in order to get the answers you need. There are some things that they will not be able to do anymore like they might have done before. It's no longer there. Healthcare is not what it used to be, which I find very disheartening. So let's see. This guy, because he mentioned it's a cover your backside entry. A typical non-ICU patient stay in a hospital generates approximately 200 pages of gobbledygook in Epic. Epic is the electronic system. And one of my healthcare hospitals uses Epic. Only about half page of this will be of any clinical relevance to the problems at hand. The rest are recitations of normal lab values, normal vital signs, and radiological reports, recommending additional studies which are usually not relevant to the problems at hand. This wastes clinician time reviewing the swamp of data. And It's true. When you get a report from your doctor after you see them, I don't get them when I go to my, I get it electronically. It's the same stuff over and over again. What kind of medications or herbs and all that kind of stuff. What is she taking? What's her history of surgeries? What's her medical background? All of that. And it's repeated. So if it's repeated for me, I think what this gentleman is saying is it's not all relevant, because it should be in one place and not repeatedly put through. So that's why it wastes their time. When a clinician is trying to help the patient and they have to go through all that. The time available for face-to-face patient encounters is diminished due to the amount of time physicians are required to spend feeding these electronic systems. The solution is not to employ more mid-levels or scribes to reduce the physician's burden. It is to remove the burdens. The practice of medicine is not a spectator sport. I won't say his next comment. Today's practice of medicine, and the author is to be commended for pointing out how difficult it has become to do our jobs and meet patients' expectation in the fragmented is non-datum dative environment. Patients don't appreciate that there has never been a fully realized increase in payments that cover the increased administrative costs. So it is now impossible to meet patients' expectations, and many of us, suffering with the moral crisis and economic burden, are contemplating leaving the profession far earlier than we would have preferred, because none of us wish to do poorly what we could otherwise do outstandingly well, without the rainbow of impediments showered upon us. Reading this, and I read a bunch of other comments that were in this article, that were followed through from the article, I see frustration. As a patient, I'm seeing it. Now, one of the tests that I had done, I can't get the answers. 3-4 years ago, the doctor would have called me up and said, Laura, this is what's going on. Do you have any questions? You ask, and it's done, and it's like, okay, if you have any questions, you can come in for an appointment. I expected that after one of these appointments that I just had, a test that I had done, and I didn't get that. And so I started getting angry. And I started getting frustrated, and it took me a week and a half to finally get through. But also, I am aware of what's going on in his clinical practice. They are down a few physicians. They are down in different areas. Now, is this his fault? Some of you might say, well, it's not your problem. To me, no, it's not. It's not my fault. It's not my responsibility. But it is my problem as a patient. It's your problem as a patient too, because we're not getting the care we need because of the burden our physicians are under. It doesn't matter if they're a specialist, primary care, or whatnot. Now, with my husband's doctor, who had sent him, same time frame, just a couple weeks ago, sent him for a chest x-ray and some blood work and stuff. He's not affiliated with a hospital setting. He called my husband up. He said, this is what your test results are. This is something we need to be concerned about. Do you have any questions? David said, no. Is there something I need to think about? And the doctor answered him, and then the doctor said, if you want to further talk about this, we can make an appointment so that we can discuss it more in depth. So David got off the phone, and I said, what are your thoughts? He goes, no, I'm comfortable with what he told me. And I said, and what are you going to do about it? He says, I don't know. He goes, I think I'll think about it. You and I will kind of like see what we can do and see if it improves. But he has the option to go see that physician. What he did different than what my doctor could do, and please understand, and I do see what's going on here, is that this doctor has his own practice and he has a reputation. And not only that, but he sees the patients very differently than a corporate business. Yes, his practice is a business. He's in the business to make money. And so he is doing it appropriately with patient care in mind. So I totally respected it. And I even asked him one question. And he goes, He answered it and it was quick. I can't get that, and I requested it, but I think sometimes because when a physician is so busy, as we read about what this doctor had written, they can't hear us. And that's what I'm seeing now is, are you hearing me? I did talk to his nurse, and sometimes, and I could tell that she was out straight. You see, sometimes we are not able to see the whole picture. We go in and we see our doctor just for clinic. They've got a smile on their face. They're really happy to see you. They're happy to see you when you're doing well. They're concerned for you and happy still to see you when you come in with an issue. There's no doubt about that. But what you might not know, when they come in to see you with this cheerful disposition, they might have just been with somebody who has a horrible situation that patient has to contend with. We don't see that. The only time we see it is if we are that patient. So why am I sharing this today? I'm sharing it because I think sometimes as patients, we get upset. The only reason I was upset is because I was asked if I had questions to let him know. I did, and it took him a long while. But I also realized the time constraints he has because he's picked up the slack from the lack of staff members. And again, I know that some people are saying, well, that's not your fault, Laura. No, it's not. But sometimes we have to step back and have a little compassion. My husband thinks I have too much compassion. You might agree. All I know is that I am very grateful that I'm as healthy as I am, even though I have complications. I've decided this was kind of like the final straw of trying to get my healthcare provider to show the care he once did. Because I really don't blame him for this. I think he's frustrated. And as I shared with my husband, I don't think he's frustrated with me. I don't think his nurses are frustrated with me. They're frustrated with the fact that they have more complicated patients, or they're frustrated that the paperwork takes too much time. And it's true. There was a thing that I wanted to know, is this, it used to be pre-authorized and now you don't need it and all this other stuff. And so I was trying to figure out what was my out-of-pocket cost going to be in January. Do you know how long it took me to get that information? My nurse was trying to get the pre-authorization. And for another thing, it took us days, and she called out, Laura, could you please try to figure this out? Can you see where this is at? It took days. So what they're dealing with is getting a pre-authorization for me, one patient, taking days. She reached out to me because she knew that I had the availability, the know-how, and how to try to maneuver around the red tape, I guess you would say. But I still don't, because when I call the insurance company to see if something is going to be paid, well, what's the code? I have no idea what the code is. I am the patient. Now, I did take some coding. I took the course in it, and the reason I'm not a medical coder is because once I was done, they changed the rules and they said, oh, you got to start all over again. I said, no, I'm not doing that. I'm not going to put 2 more years into this. But I did learn a lot through there. Codes change all the time. So when they asked me, do you know what the code is? I said, no, I am the patient. I'm telling you what the procedure is, and you need to tell me if it's covered. Oh no, we need the codes. So you go back to the billing of the facility. They don't know the codes. And they say, well, you need to go to your doctor. So you've gone to here, to here. Now you're over to the doctor's office. The doctor doesn't have time to kind of filter through, okay, what is the code I'm going to use? Because what happens if he does something slightly different and that code changes? We have become a society of numbers and codes, and it's no longer about the patient. This is my viewpoint. I don't know if other care providers feel this way. But I'll tell you, as a patient, I have cried a lot this year because I feel like my voice is no longer heard. my presence is no longer valued. My needs are not valued. The dollar signs are important. And my husband and I have so much that we have extra to spend on the co-pays and stuff like that. And when I was planning for those procedures in January, I was trying to find out how much it was so we would take a little bit extra out so we didn't have to have it come out of our own. It could be pre-tax type stuff. And you just get to the point where it's like you can plan and plan and plan and plan, but you can never be prepared. So I sit back and I told my husband last night, I said, I don't know if I want insurance anymore. He goes, are you sure? Because we both have been talking about this for years. I said, honey, it's just getting so complicated and it's so much work on our part. And as we get older, we're going to have to someday go on Medicaid or Medicare or whatever. I guess they make you go on it. But you know how much money that costs? And then the amount of money that you have to pay on top of that for Plan B, Plan C, D, whatever the number is, or alphabetical letter is. And I've done a video on the Advantage plan, so I'll try to link that. But be very, very careful on what plan you choose as you get older. So I told my husband, I said, I don't know. I said, because I don't want to die in a hospital. I don't want to die in a nursing home. I just want, when my time is up, I just want to be comfortable at home. But what about these complications that I have? One time, one of my doctors said to me, but Laura, and this is when the first time I thought about not having insurance, but Laura, you have all these issues where you need health care. I said, I know, I want to give up on it. So if I've been wanting to give up on it for 4 to 6 years now, here I am, and it just seems like it's just gotten worse. And then I read this from a doctor's point of view. And by the way, I read a lot of this type stuff because it gives me an insight. Not only that, when a doctor says something to me, I'm hearing it. I'm one of those people that doesn't forget much. So if somebody shares something, whether it's personal or not, my heart, I think, I just want to always think for them, not think for them, but think about them. I care about them. I'll pray for them if necessary. But I'm just kind of hurting for them when I should be focusing on me when I go for healthcare. What I'm trying to get at is be mindful of the circus that your healthcare providers are in. And it truly is a circus. Today, they might be guarding elephants. Tomorrow, it might be monkeys. We just don't know. And the only analogy I can think of is monkeys because of how crazy it is. And we can go in and we can be patient, and I do suggest that you try to be patient and compassionate. And if your appointment needs to be canceled or rescheduled, understand that there's usually reasons, and sometimes we get upset because we've waited for so long. But I think we can take a moment and give them grace. In the other side of it, though, and this is where my husband disagrees with me when I feel that way, is that they need to show the same respect back. I think as a society, this is my viewpoint. First of all, when patients are sick, psychologically tormented, all of those things, they can have a horrible situation going on, and staff is reacting to that. Whereas before, they wouldn't have reacted as much. But still, if we're in a normal situation and we're frustrated and stuff like that, we can at least come to the place where we communicate, hey, I'm having a hard time, this is what's going on. Or if you feel like they're not hearing you, say, I'm not thinking that you're hearing me. It is okay to say that. You will encounter some very arrogant doctors. They're out there. But I want to believe that most healthcare providers want to make you well. They don't want to see you in the office all the time, but they want to make you well. They don't want to see you in the ER or in the ICU. And when you are there, They want to see you improve. So as we talk about this healthcare, what I call crisis, and I don't know how else to describe it, but I'm just kind of like, I'm discouraged in that we are spending money over money over money, and we make decisions, David and I make decisions, it's like, no, we can't afford that. Because people are going into debt for healthcare. We did it a long time ago, but today, it's worse. And then when consumers have credit card debt, up the yin-yang, and then they have healthcare debt, it's very complicated, and that adds additional stress to your lives. So what I would recommend doing, I'm not saying don't do what you medically need. If you need to do something, you need to do it, and that's between you and your physician. I'm not here to say don't do something. But I do recommend, and I know that an honest doctor would feel this way, if you can prevent illness, if you can prevent it by eating healthy, and I can't say our foods out there are all that great, that's for another video topic, but if you can do your best to eat healthy, try to treat things at home. If you get a cut and it's getting infected, or you make sure you wash it out. Goodness, there are simple things you can do, inexpensive products on over the counter, and you can take care of it. You put some ointment on and bandage it up. Just because I do an herbal blend or something like doesn't mean there's not ways to stop an infection. And if you can do as much as you can on your own, that would save from so many people being in the doctor's office. That would relieve their load. Now, I realize some of you think, well, that's their job. No, actually, your health is your responsibility. Their job is to help you when things aren't going right, to give you direction before it gets to the point where you're in the ER or in ICU or needing a medical procedure. There's some things, I've had some medical procedures I wish I never had to do, but they were done. And, so these are things that I don't think I really had a choice on, but my health, if I want to stay well during the viral season, what am I going to do? We are going to make sure we do our best to stay back. And if we do get a virus, we are going to self-treat the best that we can. Because when you go into some place and you're sick, and the bulk of people do not want to wear a mask, you're just making more and more people sick. Now, I'm not going to argue on mask wearing and all that stuff, because I think it's personal. I think there's just a lot of controversy out there for another video. I just think we need to be kind. But if you want better care, then let's not overload the ER or your doctor's office and start caring for ourselves. And then when there's less and less people going into our doctors, maybe at that point there will be more openings. Now, is the problem the patient's responsibility? Just that part. The other part is the administration and the insurance and all that stuff that is making a mess. And that's the bulk of the problem. So I wanted to share that, and I know I rambled a little bit, but I do think that for your health care with the doctors that you do have and that you love or you care about, however you want it, if you trust them, that's the key thing. Do you trust your doctor? You don't want to lose them because you want to give them support as they support you. That's what you need to do. Go to the table with a positive attitude, ask your questions, be prepared to ask, and give them some grace because they don't get enough of it. I bet if you asked any doctor, you walk in at the end of the day, how was your day? They'll probably lie to you and say, oh, it's been good, unless they know that you care. And I think we need to do more caring for our care providers so that we can get authentic care for ourselves. Folks, I hope you have a great day. I hope this was informative. I appreciated being able to read that to you. And I know that this is a little bit longer than I planned on doing, but I thought thought that it was important. We're running into a new era with the new virus that they're talking about, and it's viral season and all this other stuff. And all I do is I'm experiencing some testy care providers. And I don't understand why, because I'm always kind to them, but I'm sensing some energy that is not healthy, and for them as well as patients. So maybe I'm wrong. Maybe there's healthcare providers here who are listening. Just say, no, you're all wrong, Laura. And so if you are a healthcare provider watching this, first time watching my channel, please subscribe. I'm not going to talk about your specialty. If you are a nurse, share your viewpoints. You don't have to claim that you're a nurse. You don't have to claim any of that, but share your viewpoints, because I think our providers are hurting. Even though patients need your help and we're hurting, I think our whole society is hurting. Have a great day, friends. Give grace to somebody, give love, and say thanks for those who are caring for you. Have a great day, and God bless.